Hello everyone. So coronavirus, unless you've been living under the rock, there is not a chance that you would have not heard about this so far. You would have at least known what it is and the impact of coronavirus across the world, or at least you would have heard some news about it. So I'm making this video just because there's a lot of rumors that are floating around. There are two types of people. One is over optimistic people who are trying to be too positive, but again, they're sending false information on WhatsApp and social media, and over pessimistic people as well, trying to send too much negativity and too much scary information. So this information is out there. I mean, you can always go and fact check it, but not many people do fact check it. They keep sending WhatsApp forwards, Facebook posts whenever they get it, and there's so much of false information out there. I'm just trying to make a small video to try and clarify as much as I can. I'm not an expert, I'm not a medical professional, but this is all the information that I've fact checked with WHO, World Health Organization, in multiple news sources, in recognized news sources basically. One of the most important rumors that keeps floating around is glorifying Indian herbs like turmeric, garlic. If you eat turmeric and garlic, or if you eat these kind of herbs, then you will not get it, or this is a cure for coronavirus. This is completely factually incorrect. While these can improve your natural immunity and natural health, there is no cure. There is no natural cure against coronavirus or COVID-19, which is a strain. It is definitely a good practice to have these natural herbs, because they can definitely improve your natural immunity and your natural health. But don't forward a message saying that it can prevent COVID-19 or coronavirus. The other most commonly forwarded is medicines. There's always a forward that goes on saying that there's a medicine here, there's a medicine there, somebody's invented a medicine. Even if somebody has invented a medicine, or somebody does invent a medicine, it takes at least 12 months of trials before it can be administered to patients. For example, a company called Moderna, which is researching using RNA sequencing, like DNA, there is a messenger RNA in the body, and they've used the messenger RNA to create a vaccine, and they've successfully started the human trials yesterday in US. But even though they have a vaccine ready, it will take at least 12 months before it can be administered to normal human beings. The human trials have started. It is by no means a definite yes that the vaccines are going to be administered next month or in a couple of months. It will take a minimum of 12 months before it can be administered to patients. The other common rumor is that when summer comes, this will go away. When in humid countries, in hot countries, this is not going to create an impact. If this was true, you won't see this kind of an impact in countries like Singapore and Malaysia, where it's always hot and humid. So it's not true to say that it's only impacting the cold countries like in Europe and US. It is impacting across all geographies, and it is impacting across all climatic conditions. So in fact, the only continent where it is not impacting is Antarctica, because there's nobody living there. But it's practically spread across all continents and all countries. It's more than 100 countries now have confirmed cases of coronavirus. So it is definitely spreading faster than anything that we have seen before in our generation, or in at least the last 2 or 3 generations. Another common rumor is that children and young people don't get infected. They are immune to it. They are not immune to it. Everyone gets infected if they come into contact with the coronavirus. Children and young people who are healthy young people, they have lesser impact from it. This is like a chickenpox situation where smaller children, babies and smaller children, they have less impact from chickenpox, whereas when adults get it, the impact is several times higher, the pain is several times higher. So coronavirus is again similar. Young adults and young kids, they have better immunity in their system, and their natural immunity fights against it, and they get better. The chances of a serious problem for them are lesser, and the chances of serious problem are higher for older people, like people above 60, or people with underlying health conditions. If you have a kid who already has a breathing problem or underlying health conditions, they can also have a severe impact because of this. So We shouldn't be saying that young people and kids do not get impacted by it or do not get infected by it. They get infected, they can act as carriers, but serious impact might be lesser for them. So it is actually a respiratory tract infection. So the main part of the body that gets infected is the respiratory tract. So it causes shortness of breath, it causes breathing difficulties. And normally what the hospitals do when people get breathing difficulties is that they give you the ventilators or the artificial ventilators, which helps you breathe better because your natural breathing process has been infected, has been affected. Now you would have seen this in most movies where they give you the ventilators. Anybody who's gone through an operation, gone through a difficult medical process, they do have ventilators. So the problem is that when a hospital has got about 50 or 60 ventilators, and there are about 500 or 600 people who get infected and need ventilators, then that's when the mortality rate starts increasing, because you don't have enough equipment or you do not have enough space in the hospitals or specialist equipment to treat them. Or it's not even treatment, it is to try and make them survive long enough for their body to develop the natural immunity against the disease. So in reality, the hospitals don't have any treatment as such for this. There is again WhatsApp rumors that says that this medicine will cure it or that medicine will cure it. Hospitals are treating patients with these kind of medicines. They're not treating patients with these medicines. They are actually putting them on ventilators, and their natural immunity system is developing the antibodies that are fighting the disease, and that's how they are getting cured. That's how people are getting cured. So the most common rumor or the most common difficult subject is people getting reinfected. There is not enough proof to show that people are getting reinfected. Although there are cases that are being reported that people who have been released from hospitals are coming back with the infection. So this could be multiple reasons, but one of the primary things that we need to know is the method of testing. There are two types of testing. The first one, quick and easy or cheaper method of testing is testing for the antibodies in the body against COVID-19. So that's an easier way to test whether the body has developed antibodies. If it has developed antibodies against COVID-19, yes, they have a COVID-19 strain, and they confirm that this person has got coronavirus. But this is only true when the body has developed the antibody. So if you are being tested when you have coronavirus and your body hasn't developed these antibodies, then these antibody tests are not accurate. So some of these cheaper tests that are being occupied by some of the hospitals, they are not accurate. The most accurate tests, which are developed against all strains of the COVID-19, they are the more accurate ones, and the fastest test so far is a 2-hour test by a British company. But there are 10-minute tests, 20-minute tests, but those are testing for literally antibodies which may not be accurate. As a result of which somebody might have been tested inaccurately, released, and then they're coming back when the actual strain is showing in their body. Lastly, and most importantly, a lot of people keep saying, trying to be optimistic, Ebola had come, swine flu had come, bird flu had come, so this is going to be similar to it. If you have not already heard, you need to hear all these scientific advisors and all of these medical advisors who are probably 50 or 60 years old, and they are saying that this is the worst medical emergency that they have faced in their generation or in their lifetime, basically. So in the last 50 or 60 years, the world has seen nothing like this. Forget the medical impact for a minute. The number of people, the mortality rate is definitely low. The number of people who are going to die is definitely low. But the economic impact that it is causing is catastrophic. A lot of industries have closed down. A lot of businesses have started getting impacted. There are countries who are dependent on tourism entirely, and they're completely closed down. Restaurants are getting closed down across Europe. Cinemas are getting closed down across Europe. All major establishments, shops, everything is getting closed down. People who work here are not going to get their paychecks, or not going to get their salaries. And there are a lot of people who live from one paycheck to another paycheck for their rents, for their food, for everything, for essential commodities. They're not going to have enough money to even pay their mortgage or their rent. So the economic impact that it is causing is huge. It's disastrous to a lot of families. Even if they're not getting impacted or infected by coronavirus, the impact that it has caused is huge. So let's stop saying that it's not going to come to us, it's not going to impact us. Be prepared for it. Save some money, put some money aside, as an emergency fund. Put some think about what you're going to do when it hits the community, not just your family, not just and as an infection, just as a whole impact to the economy, as a whole impact to the society. Finally, the UK's response. So you know that I live in UK. While the entire Europe has adopted a different strategy of a complete shutdown, most of the Europe have closed down schools. France, Italy, Germany, they've all started closing down schools. Pretty much the entire Europe is on shutdown. They've closed pubs, they've closed restaurants, they've closed cinema theaters, they've closed everything. UK is still continuing to function as normal, and schools are still open. So the chief scientific advisor of UK believes in a slightly different approach. The term herd immunity was being used last week, where they were saying that they want 60% of the population to get infected, and then that's the only way that they can stop the spread of this infection. And they're not even testing the whole population. They're testing only people who get admitted to the hospital with a serious infection. So they're not actually going and testing. The advice for people who have symptoms is to self-isolate and stay at home, and they're not being tested. So the numbers that UK is reporting is substantially different to the entire Europe's reporting, because it's not enough people are not being tested. While the WHO yesterday said that the only way to fight this is test, and you can't fight a fire that you can't see unless and until you test it. You will not be able to see it. UK has adopted a different strategy to entire Europe, and only time will tell whether this is the correct strategy or not. But we are still continuing to function as normal, even though the advice is getting stronger and stronger this week that stay indoors as much as possible for other things, despite the fact that we are sending our children to school, despite the fact that every other activity is still open, the cinemas and everything are still open. So it's a little bit odd, considering that every country in the world who's getting impacted by coronavirus is starting to do a shutdown. UK seems to be functioning as normal, despite knowing the fact that every country is telling UK that this is incorrect. We are practically telling the other countries that no, we don't believe that what we are doing is incorrect. So finally, I think this is the most important time where we need to start showing some empathy for our friends and neighbors, because there will be people around you who do not have money because they not have their salaries or they not have their paychecks. So as much as possible, do some small help, and people, if they're self-isolating around you and if they can't get groceries, and if you are healthy, try and get some groceries for them. Check with them, keep connected to them with social media or WhatsApp or phone, and make sure that if they need help, and if you are in a healthy position, that you are able to help them, so that when you get infected or when you have to self-isolate, then other people will be able to do the same thing for you. So I think this is the time that we need to be more empathetic to our neighbors. We need to be more empathetic to the society around us. So hopefully some of you found this useful. Let's do a bit. Thank you.